102.7 Bomb FM, 8:16, 16 minutes after 8 o'clock. Welcome to it. It's the morning show here on WMOM there. And you know what? Kind of overcast conditions outside. And sometimes days like this can get us a little bit blue. But if there's something deeper happening, well, maybe it's something that the next few minutes talking with Marie Jensen, Director of Adult Services at West Michigan Community Mental Health, can kind of outline a little bit. It is Mental Health Awareness Month, and we want to talk about this topic, especially adult mental health. Marie, thanks for coming in this morning.
Thank you for having me.
Yeah,
I appreciate it.
Absolutely. Thanks for stopping by, and let's talk about this topic. I guess my first question is when we talk about mental health awareness, what are we trying to be aware of in general?
Sure. So a basic definition of mental health is how we think, feel, and act, or I kind of describe it as how does it impact our ability to live, laugh, and love.
Okay. Good definition there, because those characteristics are kind of what keeps us going, right? And doesn't I'd say put us back into that circle of things.
Mm-hmm. Sure. And mental health is so important because, like I said, it can impact our ability to live. So meaning, how we take care of ourselves, how we take care of our family, laugh. So like it can impact our mood, our emotions, and love, it can impact our relationships. We might have a hard time relating to people. We might have a hard time communicating with people. And those are all really important for us to feel like we live a fulfilling life.
All right. When we come to Mental Health Awareness Month, what do you think from a healthcare provider, from a healthcare standpoint, that you're trying to accomplish in a month like this?
Well, I mean, even what we're doing right now is huge. Just having conversations and leaving that door open and trying to reduce the stigma. A lot of times people take quite a bit of time to actually reach out for help for mental health issues. So the more we talk about it, the more open people feel and the more less stigmatized and less vulnerable they might feel in talking about it.
I pretty much know the answer to this next question, but I hope you dive into it a little bit is, things that have changed. And I know when we talk about further back, 10, 15, 20, 30 years ago, but has there been changes in regards to mental health and maybe the being able to, as you mentioned, reach out, being able to react from the healthcare standpoint in the last maybe 3 to 5 years?
Oh, definitely. I've noticed a change in using technology. So even just the ability to get access to help has increased immensely with the use of technology. There's so many different great apps out there. We have one at CMH that we use called My Strength, which you can access through our website. So that's just a wellness app on managing anxiety, stress, chronic pain, all different types of issues. And those kinds of things I think have really helped people, especially in our rural area that might not have a lot of access to different professionals, at least get some sense of help, and then the access to the professionals when they do need that.
And the nice thing about West Michigan CMH, you handle Mason, Oceana, and Lake County, correct? And so having that app, and when it comes to that app, is it easily navigatable though?
Oh, yeah, definitely.
Okay.
And even just websites, and there's support groups that are more abundant now, and the ability to use Zoom or Teams or whatever you have. I mean, before we didn't have that. We didn't have the ability to see somebody virtually for appointments and things as often as we do now, and that's helped a lot. You don't even have to leave your house sometimes to get the help you need, which is really great. Have
you personally seen and experienced that helping a patient?
Oh, definitely. Yes. And it's great to see because sometimes with mental health, it's really hard to navigate the community, and to get out of your home might be a huge task because you have anxiety about leaving your home or anxiety about getting in a car. So being able to reach someone where they are and get them the help that they need has been a great impact for sure.
Somebody's going to kind of be the devil's advocate. If you don't mind, I'll ask the question is a lot of that one-on-one though in person, is that better than the using the technology, or have you over time seen that it's almost as effective or equal?
I think it really depends on the person. Some people definitely want this like one-on-one sitting in a room with somebody. Other people really do well with that virtual mechanism. Some people prefer group settings, which we also offer. So it really is an individual thing, and the treatment for mental health is very individualized.
And that's where, when somebody does reach out to West Michigan Community Mental Health, you establish that that relationship of, okay, what do you feel comfortable with, and you ask them for that, right?
Right. Yes, it's very we call it person centered. So we will say, hey, we want to know what you want to work on. How can we help you with that? Here's the things that we can do to help you with that. But that person really drives their experience, and that's so empowering for people with mental health issues, because oftentimes you feel very out of control. You don't feel like you have options or autonomy to make your own decisions. So that's what we really try to do, is put the person at the forefront, and they can really drive the way they want to go.
Good information. We're talking with Marie Jensen, Director of Adult Services at West Michigan Community Health, Mental Health this morning. Let's talk about concerning behavior, signs and symptoms. And I would assume that the first part of that response is everybody is different. Every scenario is different. But is there a constant at all?
So I think some things to look for. So signs are usually things we can see. Symptoms are usually things people experience or feel. So if you notice, maybe a sign, for example, would be maybe they are not bathing or not dressing appropriately, and they're usually very clean and put together. That's usually a sign something might be going on. Another sign might be they're losing weight rapidly or gaining weight rapidly. Some symptoms they might describe would be they feel like they're very anxious or sad, or they notice they're very irritable. They might describe having issues with sleep. So these are all things that when you kind of talk with somebody, you can work through, and sometimes people don't know to bring those things up, so you might have to ask some questions around that to get those answers, but those are usually some of the bigger ones. And there's a long list of things people can experience, and a lot of what I just described, I'm sure we've all experienced, but it doesn't mean that we have a mental health disorder. So I want to point that out. It really has to do with how it impacts your life. So there might be a day where I say, I'm going to isolate and not go out and not see people, but that doesn't mean that I am diagnosed with a mental illness after that. It might just mean I needed a day off from people. So whenever I talk about mental health symptoms, people often say, ooh, that sounds like me, or that sounds like my friend. That doesn't necessarily mean that they have a mental health disorder.
And I'm glad you brought that up. And can we then start saying, okay, if it's something that's a prolonged, if it's consistent and it's happening for weeks, months, and so forth, then that's more alarming, right?
Right. And really the length that it, or the impact that it has on your life. If you're missing work repeatedly because you can't get out of bed in the morning because you're so sad, that definitely is something you should probably talk to somebody about. If it's one time and you just are struggling to get out of bed because this horrible weather we're having and all those things, that's not as big of a reason to do that. But yes, prolonged over weeks or multiple times of it occurring, for sure.
Do you think it's easier for somebody with those signs and symptoms to self-diagnose themselves, or is it more those individuals around them, their peers, that see those red flags? Where do you think that stands?
I think it's dependent on each individual. I think sometimes people don't always notice those things because it just becomes this everyday experience for them. And the same thing goes on the other side too. If you're seeing someone every day, you might not notice those changes in them because you're exposed to it all the time. And actually, a lot of the research shows people delay getting treatment quite a bit. They recognize that they're struggling, but the stigma behind getting help for mental health is still there. I think the last time I was reading statistics, it's a little over a year typically.
Okay, wow.
So think about experiencing that for over a year and feeling not great and not well, and you delay getting treatment. That's a really hard thing to go through. So
we're talking with Marie Jensen, Director of Adult Services, West Michigan Community Mental Health. Let's pick up on that for just a moment here. And if somebody goes a year, does that, the farther they go down that timeline, Is it harder to reverse things?
Reverse things maybe isn't the word, but it definitely can make symptoms more exaggerated. It could create more issues. It definitely can impact your life more. So yeah, I mean, the longer you wait to get help, you can see, that things do get worse for people.
What about conversations that we need to have or should have with people experiencing that mental health?
Sure.
How do we approach that? Because that's not easy, is it? It's never,
right.
Especially if it's a friend or a family member, somebody close there. It's got to be a difficult conversation.
Yeah, it is. I think, approaching people non-judgmentally, being open is very important, trying to listen well. And that doesn't mean necessarily telling them what to do or telling them to snap out of it. I really wouldn't recommend that. That's not ever, I don't think I've ever seen that work.
Yeah.
But, just being a present and asking them what they want, asking for permission to talk with them, asking for permission to sit with them. Again, we talked about earlier that feeling of not being in control. And again, giving people options is really the way to go. And you might not be that person that sees them through to getting the professional help, but you might be that first person where they said, I actually feel comfortable talking. And that's huge. People need those people in their life.
One question I didn't ask you, and if you're just joining us, Marie Jensen, Director of Adult Services, West Michigan Community Mental Health, with us this morning. Something you can watch on our Facebook and our YouTube, listen to on your smart devices, and of course over the radio. Is there things that happen that in most cases trigger the mental health issues that people have? Like, is there because we talk about like PTSD. But is it usually something related to something that happened in their life?
It could definitely be. It could be even genetic predisposition. It could be the environment you were raised in. It could be it could even be some medical issues that can cause some mental health issues. So it's a wide gamut of things that can cause mental health issues.
How do you dive into that with that person? I know that's probably a whole separate conversation, but how do you start by kind of diagnosing that? I mean, what is that process?
Yeah, I mean, we ask questions about people's history, their childhood, so, what physical health issues they might be experiencing, any sort of trauma they've been through or disturbing events. Some people don't like describing it as trauma, so we might call it disturbing events or things that really bother you that you've been through. So we really try to get a whole picture and look at the person as a whole person, not just their mental health. Physical health as well is so important that we look at that.
Okay, good point there. Let's talk about the options that are available. As part of Mental Health Awareness Month, we have to be able to maximize the ability for people to reach out. Phone calls, emails, text. It's all out there. Where do we start? How do people get a hold of who they need to get a hold of?
So at CMH, we're available 24/7, 365. You can call our 1-800 number. You can go to our website. So that's one option locally here. And we do have crisis services. We do have just general mental health services, therapy, case management, things like that. Peer support services are really unique to community mental health organizations, and those are people with lived experience in the mental health field, or in their own mental health recovery, and they get to guide somebody in the process of getting help, and that's so impactful, and we do have those available at CMH.
Okay.
There's also national resources. Specifically, I would reference calling 988. That's the new national suicide hotline that we've talked about before. So if you're ever in a crisis, reach out to that 988 number as well. If you want more information about mental health, signs and symptoms, or you want to learn a little bit more how to help somebody, there is a training for any community member, doesn't matter your background, called Mental Health First Aid. So if you go to mentalhealthfirstaid.org, you can find trainings. And then there's also a ton of resources on that website that I would recommend that are evidence-based accurate information around different disorders and different signs and symptoms.
All right, good information there. Locally here in Mason, Lake, Oceana counties, reach out to West Michigan CMH. And you brought up a very good point that you have team members on staff that have gone through mental health issues and have overcome them and now helping others. And I think that to be able to talk to somebody that has been in those situations, it tends to be a bit more of a comfortable place for people, isn't it?
Oh, definitely. And that lived experience is huge. I think, again, everyone is individual. However, going through the mental health system is an experience in itself. And so someone that can say, hey, I've been there and this is what worked for me. Would you like to try that? What are your barriers to getting help? How can we help you with that? I know what my barriers were and this is what I did. That's huge. And again, it's destigmatizing mental health issues and having conversations and seeing somebody who's working full time to help somebody who also is still in recovery themselves for their mental health issues. So.
Very good point there. West Michigan Community Mental Health, that's a huge resource right here in our area. Website, wmcmhs.org. That phone number as well that you can reach out to them, 1-800-992-2061. Again, 800-992-2061. And sometimes it just takes that first phone call, doesn't it?
Yes.
Okay. Marie, thanks for coming in this morning. We appreciate you.
Thank you so much for having me.
You got it. Marie Jensen from West Michigan Community Mental Health. If you missed any part of this segment, check it out on our Facebook page and our YouTube channel. You can watch it in its entirety. It is Mental Health Awareness Month, and let's keep that conversation going the rest of this month and obviously around the year. It is now 8:32 on 102.7. It is Mom FM.